Autism is a neurobehavioral syndrome marked by qualitative impairments of social interaction and communication and by restricted, repetitive, and stereotype patterns of behavior. This disorder was first described by a psychiatrist at Johns Hopkins Hospital named Leo Kanner. He described these children as having difficulty relating to others in a typical pattern, extreme aloneness, significant speech deficits, including mutism, obsessive desire for repetition and sameness, bizarre repetitive behavior, lack of imagination, but normal physical appearance. There are 6 distinctive characteristics of autism, and they are atypical language development, atypical social development, repetitive behavior, problem behavior, sensory and movement disorders, and differences in intellectual functioning. Autistic disorder falls along the autism spectrum disorder. Along with this disorder, there are 4 other subtypes, and they are Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and pervasive developmental disorder. According to the CDC, about 1 in 68 children have been diagnosed with autism spectrum disorders. These occur among all racial, ethnic, and socioeconomic groups. Autism spectrum disorder is 5 times more common among boys than among girls. Studies have been conducted throughout Asia, Europe, and North America, giving autism spectrum disorder about a prevalence rate of 1%. Signs and symptoms of autism are presented before the child reaches 3 years of age. Early detection enables these children to reach their full potential. The cause of autism is still unknown, but it is likely that the environment and genes interact to cause the symptoms of autism. There is no cure for autism, but there are therapies and interventions to help these children reach their fullest potential. These therapies include behavior therapies, where they work to decrease the unwanted behaviors and increase good behaviors, and speech and language therapy, where they work to improve the child's communication skills. One of the most famous interventions is ABA, also known as Applied Behavior Analysis. This works to help change the behaviors and teach the child new skills. Applied behavior analysis uses operant learning. When a behavior is followed by a reward, it'll be more likely to be repeated. A number of studies have shown that applied behavior analysis produces improvements in communication, social relationships, play, self-care, and school. The studies were conducted with children and adults, and both showed improvements. There is no medication for autism, but there are quite a few pharmacological interventions. These medications help with hyperactivity, aggressiveness, self-injurious behaviors, withdrawal, impulsive behavior, and anxiety in these individuals. Some of these medications include stimulants or amphetamines such as Ritalin, tricyclic antidepressants, beta blockers, and lithium. These medications have been found to benefit some individuals, but you have to remember that not all of these medications are for everyone. Some antipsychotic medications such as risperidone have been shown to be effective in working with irritability in autistic children. Others, such as stimulants and mood stabilizers such as lithium, have very little evidence of working, and they all have side effects, some being weight gain, fatigue, irritability, dry mouth, and insomnia. Something is sweeping our nation, and we don't know the cause or have a treatment. But let's face it, people with autism just want to be treated like anyone else. So know your facts. Autism speaks. It's time to listen.